Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk a little bit this morning about how to move the lower jaw forward to reduce pain. Now, sometimes you can move the jaw forward and it'll completely eliminate the pain. You can do it several different ways to help get it. To move it forward permanently where it actually can fit up there is a little more complicated. Like you could come into somebody with a TMJ pain and he could give you a little mouthpiece to go in, or you could make a mouthpiece that would open your mouth about 2 millimeters, and just that 2 millimeters of opening it, the condyle moves back here when the teeth move, and a lot of times that mouthpiece will move it enough to get it away and it'll quit hurting. And then you take the mouthpiece out and the jaw goes back where it was, pressing into this retrodiscal tissue that we've shown you in the other video now, and it would come back again. In other words, you wear the mouthpiece and the pain will go away, you take it out and it'll come right back. And then if you take medicine to stop it, it just still hurt. So I'm going to show you how you can actually move the teeth, and that moves the jaw, and that when you move the jaw forward, it'll bring the condyle away from this retrodiscal tissue, and in many, many of the cases, this relieves the pain. But I'll show you several ways we actually move the jaw forward. So here's some drawings that I made up back a few years ago, and I want to show you. I'm going to have to get my little pen over here to draw on this. And this was done just to illustrate how the teeth meet. You can move the lower jaw back by actually pushing back on the upper jaw where you have a class 2 malocclusion. In other words, you can have a TMJ problem like this, and you wear a headgear to shove this back, and that contact point back here on all these teeth, in many cases, can move these teeth back, and if you back these teeth back up, you'll get a TMJ pain out of some people. Now, some people can stand it, and it doesn't bother them, but other people do. And you will say the headgear or whatever you move these teeth back with caused the pain. Well, that's not right. It didn't. It wasn't the headgear. It was you moving the teeth, but the headgear helped you move the teeth, and the upper teeth going back made the lower teeth go back, and that shoves the head of the condyle into the retrodiscal tissue back here, and you get the pain. And so people blame the pain on the headgear. Or anything you wear to back up these teeth can cause the lower teeth to happen. And a lot of people just do not understand that. Now, I'm going to erase the markings and show you how we can move the teeth forward without doing much of anything. You can come in and strip all these teeth. And you come down on the bottom, strip all the teeth. Just have a very slight space between the teeth. You do it with a little stripping pad used to make those about 8 millimeter pads, and you slide in between the teeth. And now we're taking a little bit of enamel off of both teeth right here. Just a very small amount. And you do a very small amount on all the lower teeth up to the cuspid. There's no need to go around the cuspid up here, but we're just doing it in 4 different places in here. Now, if we get just 1/4 of a millimeter, I mean a real tiny space in here, we're going to need to close these spaces in an odd way. We hook a class 3 elastic up, and you go down and you pull the lower teeth back. In other words, we're pulling back on the lower teeth, and it'll pull forward on the upper teeth. Now the space that we made in all these teeth is going to close, and these upper teeth will be, if you just strip 1/4 of a millimeter or 1/2 a millimeter, maybe you move these teeth a couple of millimeters forward. They'll come right up against this cuspid here, and they'll move them forward. And this elastic, pulling it in here, pulls these teeth from the front to the back, and these from the back to the front. Now these teeth will all be moved back about the same distance. But the interdigitation of the teeth, if I move these teeth up, the V point in here moves with the teeth. Now you've moved the V point back on these teeth. Now you have to bring the jaw forward to get this tooth to come up in this space right here. And that moves the jaw forward, just that much. And frequently, that's all that's required. I've had people that come in and just the least little movement would help bring the condyle out away from this retrodiscal tissue and give them relief, and then go back. A lot of you put those little pieces of acrylic between the teeth, and they just bite on that. You can make it to fit the teeth if you want, and it'll help do that. But when they take it out, it'll hurt again. Now here, you actually bring the condyle back, and it may be pressing on that tissue, and you move the condyle the same distance you move the teeth out here, and it relieves the TMJ pain. Now there's actually putting the little space in there helps too. I'm going to erase this, and we'll show where you come in, and I think I'm going to draw it here. Like if you're wanting to relieve the way the teeth, you're trying to correct a class 2, you have to bring the teeth up and over the hump out here. That corrects the class 2 relationship. And a lot of times pulling with a class 2 elastic, you'll pull and pull, and it won't go over simply because the teeth have resistance going here, and you bite down, they slide back, and that causes you to move the bottom teeth back using a class 2 elastic. And you blame it on that, but that's not it. It actually, if you want to keep from doing that when you've got a class 2, I'm kind of getting off the subject right here. I'm going to reduce this. We would go to this. Now you can come in and put a little bit of acrylic on the lower teeth right here. Now you can pull these upper teeth forward, and it won't have any effect on the bottom teeth down here. In fact, you might put this acrylic on somebody and their bottom jaw wants to move out, and you can move the jaw out, sometimes just putting some acrylic on top of the lower teeth there so the jaw can slide forward would stop it. But then if you take this out, it'll go back again. So I want to show you how we make it permanently go that way. So let me go back. I'm going to erase that. We'll go back, and then I'll show you right here. Now, if we go in and we strip these teeth, and we move the upper teeth from the back to the front. In other words, we come down from the back and we're going to move the upper teeth forward. And you wear a class 3 elastic, and that pulls and closes these spaces up, and it moves these teeth further up against the cuspid up here, and it moves these teeth on the bottom back against the molar teeth. Now your little pointed part going in the teeth is further back on these, and it's further forward on the ones up above, and so you have to bring the jaw forward to bring it into there, and it'll fit together right there, and that solves many of these problems. There's another way to do it also, or reduce it. Like if you want to come in here with an arch wire, so your arch wire is straight across in here. And if you put a certain bend in that wire, you can make this wire lean these teeth forward like this. In other words, you come in here and you go up and down, and you go up and down. Now you fit this wire into your slot up here, and it'll tend to tip the teeth. The roots are in the bone structure, and when you put this tip in, the crowns are going to move forward. And so you have to put that tip in the lower. It'll get, if you're perfect class 1, you've got to change the upper 2. So you're going to move these teeth forward that way. And so you want to move the upper teeth forward 2 to do that. And so you have to do that. Now when you put that on the crown, let's see, excuse me, you got to do it this way. You make this tip. And now when you tip this in there, it'll kick the crown. I'll tell you, pardon me for missing this, but I'm doing it the wrong way. You have to do it this way. So it's going to tip these teeth in this direction. So you're going to go like this. The tip, then the roots will be pushed back, but that puts the crowns forward. So in both upper and lower, you tip them forward, and that'll move the teeth back away, and that will, when the teeth fit together again, your condyle will be back away from the retrodiscal tissue. Hope I didn't get you confused on that since I was going here a little faster than I need to. That'll bring both jaws forward. The other one brought the upper jaw forward, but it brought the lower jaw back, but then you had to bring the jaw forward to get the teeth together there. But when you do that, you advance the mandible down here and free it up. And I hope you'll sit with this and kind of ponder it and figure out how you can solve a TMJ problem simply by tipping the teeth. You have to tip all of them forward if you use the wire tipping. When you're going to strip them, you actually tip the lower teeth back and the upper teeth forward, and now you move your jaw forward to get the interdigitation to fit, and that relieves the jaw back in the back of the mouth. I hope that it's hard to understand some ways, But you can do all sorts of things with the teeth by tipping and stripping and pulling the space back, or just putting something in between the teeth. It'll let them go out there, but if you take it out, it'll still be back there and it'll hurt. So thank you for watching this, and I hope I haven't confused you by making a little mistake there myself. So you got to do the tipping, and then you need to, if the wire is straight through here, you go up this way. Now if you bend that and put it in there, it will tip this root back, but it makes the crown go forward. And you just take a pair of pliers and put that tip in, it'll be down and up this way. And that pushes the root back, but makes the crown go forward to do that. And you do the same thing down here on the bottom. Thanks again, and I'm going to say bye for a little while, but I hope you'll tune in to our channel. Now we've got 2 channels, one just for orthodontic lecture channels, and a channel for just orthodontics. And we have I've covered a lot of territory and put all these channels up. We're still working on them, and it works. This works now, and it'll work 100 years from now. It's not something you're going to outgrow in there. So I'm going to clear that and finish this up. And thanks again for coming in, and we'll close out. This is just working down on the case where when you strip, if you have you don't strip in front of the cuspid, you strip behind the cuspid. This is where we've extracted teeth in here on this. And then you can do it where you have missing bias, or if you've got a molar tooth back here at the back, you can do it with all of them in there. It doesn't matter. And that's the upper retainer that we make, and the way we do that. Thank you for watching now, and I'll just say goodbye, and I hope you get something out of this. If you study it, you will. If you're just flipping through, you're not going to get much thrill out of it. But if you study this and you come up with a person with a TMJ pain, or you create a TMJ pain with a headgear or class 2 elastics or anything else, you can correct it this way. Thanks again, and I'm going to stop.